I hope that you enjoy our session today. You know that sessions with me are, vibrant, energetic, full of action, and quick. And I'll teach you a lot of tricks with our new Infini products. So let's go now straight ahead to the presentation. And let's start. I'm going to give you a little bit of information about the new product, which is Infini. Infini lidocaine. I realize very well that most of you have been having difficulties, just like me as a doctor, with the Infini that was not with lidocaine. I say it bluntly because I want this product to be the best. So with this one, you're going to see a huge difference. We have soft lift plus, S plus, M plus, L plus, and XL plus. And this is me from Dubai. So I will start a little bit with anatomy because you have to understand while we are doing the two candidates of mine that when we want to focus on the face, we have to focus on several structures of the face that are the bone, the fat, the muscle, and the skin. Because if you fix all those, you're going to have a natural result for the patient, right? So with regards to the skin, which is the upper layer, it loses its elasticity, it loses its collagen over time, so it goes and starts going downwards in a median and downward shape, giving you groovy lower lids, droopy jowls, and groovy nasolabial folds, and marionette lines. So you can fix that with fillers. How can you fix the skin with fillers? You know that the fillers are hyaluronic acid. Hyaluronic acid is going to enhance the skin by making it more hydrated, and this is why it becomes more plumpy. The other factor is, other than the skin, the fat. How many fats do we have in the face? You don't have to memorize all of these. All you have to know is that around the eye and the cheeks, from the area of the eyes towards the nasolabial folds, let's say that we have 4 fat pads, and during our life, we start losing these fat pads. Unfortunately, the fat pads that are most lateral start to be lost. And then the last one that's gonna go is the one that is located at the nasolabial fold. That's why you are going to be having what is this? That's why you're going to be having more prominent marionette lines and nasolabial folds. Everybody can hear me? Sound is good? Yeah? Let me just move. Now the voice is not clear. Oh, okay. All right. Hi Fuad. Hi Ivanka. Hi Galina. Wait. I have to say hi to everybody. Wait. Let's go back. Hi Galina. Hi Sandra. Hi Luba. Hi Taiba. Hi Katrina. Hi Lan. Hi Anas. Hi Carolina. Hi Fuad. Hi Ivanka. Hi Galina. Hi Maidana. Hi Ivanka. Hi Bassam. Hi Ahmed. Hi Katrina. Is it possible to record it? There's no way to record it. But would you like me? Listen, I'm gonna go on. I'm gonna keep on watching your messages. Do you want me to repeat all over again from zero? You want me to repeat everything from scratch? Yes or no? Hi Rafi. Hi Justinia. Hi Walid. How are you? The sound not clear. Come on. They're saying the sound is not clear. Test. 1, 2, 3. Test. 1, 2, 3. Hi, Ala. Yee! Hello. Ala, Iraq? Tell me which country. The sound is good now, look. Okay? Write your name, say hello, and say which country, please. I've visited most of you guys. I've been to Greece, to Poland, Indonesia, Bahrain, Lebanon, Egypt. Where else? Who did I forget? Mexico! Palestine, Poland, Romania. My God, Indonesia, Habibi Rafi. Lubna from Palestine, welcome, thank you. Sandra from Lithuania. Ruba from Palestine, welcome, welcome. Okay. So, I will start from scratch, okay? And I'm going to tell you in a way for you to memorize. France, allez les bleus. Mexico, España, UK, Poland, Palestine, Venezuela, Moldova, Lithuania, Serbia. Habibi, welcome to Dubai. Hello, Hossam. Indonesia, Greece. Okay, خلاص. Now I'm going to start the lecture. Going back. So, I was saying that with regards to the Infini fillers, before we all had difficulties using the products. I'm saying it bluntly. Anna's going to hate me for that, but I have to say it. It was difficult sometimes to push the product, especially the L, and sometimes the needle would like just react all of that. Now, this new product is much easier to use. No voice. This product is much easier to use. We have 5 products. Soft Lips Plus, X Plus, M Plus, L Plus, XL Plus. So same names as before, just add the plus because it's plus lidocaine. So what does the lidocaine do? It's going to be good. No, don't move the presentation. Someone is moving the presentation. So it's good because it's good for the pain for the patients, it's for the comfort for the patient. Now, I'm going to have 2 models today. One model, most likely I'm going to do her lower face, and another model, I'm going to do her upper face. I'm going to show you the difference and hope you like it, and I'm going to teach you some tricks when it comes to using these Infini fillers. Okay? Now, anatomy is important, but we're not going to go too much into anatomy. I'm just going to give you the anatomy that you need for you to be able to be injecting. So as you know, we have skin, muscle, fat, and bone, right? What happens with age? The skin is going to all go down. The skin goes downwards and medially. So your age with gravity pull, you will have the droopy jaws, the sagginess to your lower lids, the nasolabial folds, and the marionette glands are going to be prominent. Next, you lose the skin elasticity, like I was saying. The hyaluronic acid is important because it gives hydration. Do you know how hyaluronic acid works anyway? Do you know how fillers works anyway? Fillers do not work by pumping. Fillers work by attracting water. One molecule of filler, one molecule of hyaluronic acid attracts thousands of molecules of water. This is how you get the volume. And this is why you get the plump. And this is why when you do filler, you feel like your skin is better. I'm always going down and checking. Hi England, hi Oman. Hi Indonesia, hi Palestine. God be with you. Now, so we spoke about skin. Hyaluronic acid is good for the skin. Number 2, it is good for the fat. So, for you to get a good result, why some doctors, when they work, their work looks so natural, and why other doctors, when they work, it looks like they've done something. You have to know your anatomy. I always tell my students, my doctors, my colleagues, because I also learned from you, you know. If you know your anatomy, if you know what to put, where to put, how much to put, and the quantity to put, and what to put, you will have a great result. Nobody will notice. So, for example, if somebody has lost volume in the fat pads that are located here, I don't want you to memorize the entire fat pads on the face. Guys, can they see me or they just see the presentation?
Sorry?
I want them to see me as well.
You see you?
Yes.
Okay.
So, for example, if the fat pad, let's say, or I could use the mouse. If I use the mouse, they will see it.
If you close the presentation, we'll see you.
لا خلاص, let me خلاص. So I'm using the mouse here on the presentation. So for example, imagine that from the cheeks to the nasolabial folds, there are 4 fat pads, okay? And every year, I always keep telling everybody, after the age of 25, we lose from our face 1 teaspoon of fat. Yeah. Everybody, remove 1 teaspoon of fat from your face. How does it feel like? Now multiply that number by 25, for example. I am 40. So I have lost 15 teaspoons of fat from my face. How am I going to replenish those? With fillers. Does this mean that I have to put 15 syringes of fillers? No, I have to put much more. Okay? So we see both. Thank you, Carolina. They see both. Because if now I bring a teaspoon and I put inside this teaspoon fillers, do you know how many fillers I need to fill 1 teaspoon? 8. دكتورة نقدر نشوفك وانت عم تشرحي. Thank you. Perfect. So it's very important that you understand where has the patient lost its fat. If they lost the fat deep at the level of the bone, this is where you fix it. If they lost the fat that is superficial, this is where you fix it. Otherwise, you will not have a result that is natural. Okay? You got it? So I will teach you now with me and my candidates how to look into the anatomy of the face and accordingly to decide which area of the face needs to be injected, how it needs to be injected, whether it is with cannula or with direct injection, because there's big difference, and how much you have to put in there. Okay? I'm not the type of doctor that will tell you 0.1, 0.2, 0.3. No. You have to learn to see it with your eyes. So we spoke about skin, we spoke about fat. The fat is going to go down. Bye-bye, hasta la vista fat. Then the bone, what happens with the bone? Did you notice how your parents become shorter with age, right? Mom and dad, they become like this and they become shorter and make fun of them. This is what happens to our face as well. It becomes shorter and it moves forward. So over time, we lose the bone. And this is important because also I will teach you how to put the filler in a way as if you are replenishing the bone itself. Okay? Number 4. So we are now all triangle. We want to stay triangle. We don't want to become pyramid, right? So the aim is to, I'm going down with the, okay. Anybody who wants to send me anything, right away send me because I'm checking my messages. So the aim is to have a nice lifted cheek, nice lifted jawline, nice contoured chin. And this is indication of youth. Next. So it's very important for you to know your anatomy. Now, are you recording? No, we are not recording. Are we recording, guys? No, it's not recording now. So, what is so special about Infini filler lidocaine? There are plenty of fillers there in the market. This is the only one that has the same concentration of hyaluronic acid everywhere. 24 milligrams per ml for the lips, S+, M+, L+, XL+. What's the difference? The particle size. So the particle size for the soft lips and the S+ is 200, M+ is 400, L is 6, XL is 900. Okay, that's the only difference. So the particle size becomes bigger with the higher the concentration, the higher, the name of the filler. So S 200, M 400, L 600, XL 900. That's it. That's all I need you to know. Next. The hybrid technology is important because it is based on non-animal hyaluronic acids. It improves the density and the elasticity of the product. It is long-lasting. It is one of the key features that distinguishes Infini from other products, which is the stable concentration of the hyaluronic acid, which is 24 milligrams per ml, which is going to give the product more stability. No, we are not recording. Next. So, let's start with Soft Lips Plus, which is the hyaluronic acid. All of them, I said, is 24 milligrams. You don't have to memorize that, you see. S is 200, M is 400, L is 600, and XL is 900. Forget about the light structure. This is what I like. The in vivo resorption study. There was a study that was conducted with Infini, and they deducted that after they injected the filler, opposed the control other fillers, they noticed that with time, when you age, everything goes down. So what happened is Infini filler moved with the structures, which is even better because it gives a nicer and much more natural look over time, as opposed to other fillers. So Infini filler will maintain its durability for more than 12 months after a single injection. Listen, with regards to the duration, it has to do with the patient age, sex, habits, whether they smoke or not, whether they do exercise or not. There is no such thing on the planet, whether you want to convince me from now until 10 years, that will last for 1 year, please. Nothing will last for 1 year. If you maintain, it will last you for 1 year. If you do filler, the right quantity of filler, if your face needs 20 syringes of filler, and you put this 20 syringes of fillers, and then you maintain, and you keep watching yourself with boosters and PRPs and bases and chemical peels, yes, then maybe, and with a good home care product, then maybe it will last you for a year. But I don't like to hear that somebody tells me a filler that will last for 1 year, because it's not true. No filler on the planet lasts for 1 year. Next, long-lasting volume, like I said, depends. So with regards to the long-lasting volume, I'm going to give you a trick. So let's say a patient comes to you and she has lost tremendous volume of fat, okay? And I understand that some patients have a budget. I totally understand that. But you have to explain to the patient that, my dear, if you lost volume under the eyes, and you lost volume in the cheeks, and you lost volume in the jawline, and you lost volume in the chin, and you lost volume in the temples, if I only replenish the volume in one area, they will not all hold together. They will melt down really fast. So you have to put a program for your patient. If she cannot, on the spot, put this amount of filler, you can tell her, fine, I'm not going anywhere. We have 1 or 2 years ahead of us where every 3 to 4 months, you have to come back. You don't have a choice. You have to come back for you to get whatever you need. I have patients that have been with me for 1, 2, 3, and 4. Those that stayed with me, the screen is not appearing, Doc. Can you check? So those that stayed with me for years are those that benefited the most. Why? Because they followed the protocol. We filled up every single area of their faces. Now, the models that are here are very lucky because on the spot they're going to have filling for all these areas. Yay! Okay? But you have to educate your patients that if they want their result to be long-lasting, they have to put the right quantity. When I was in Indonesia, I was teaching them that it's okay to put 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20 fillers. It's okay. It's fine. Perfectly fine. There's no harm in that as long as you know what to put, where to put, and how much. But of course, the problem is the budget. Bonjour. Hi, Farid. So, with regards to the volume, I made my point. So we passed the CE certificates and the ISO, and we as a filler have something that is very special for us, which is the ergonomic syringe, which is going to be giving unified volume everywhere while injecting it. Is there anyone recording? Hello, Dr. Nat. Hi. Dimas Dui Presito. Okay. Bonjour. So let's start with the Infini Soft Lips Plus. Apparently, we're going to be using it for smoothing of the lips. You can use it for, I would say, for the red carpet. So, for example, if a lady comes to you, her wedding is in a few days, or she has a party with her friends, or she's going out on a date and she wants to look like she's looking plumpy, having plumpy lips. So you can do this for her. And there's a technique of doing it without even causing a single bruise. Hopefully I can show it to you on our first patient, Yelena. I think so. And this is also good for correcting all the smoker lines and the fine lines around the eyes. So anything that is fine, use the soft lips plus. Also, sometimes I use a filler for the lips, which is M or S, and on top of it, I use the soft lips plus, by the way, because it will give a nice plump. This is the Russian style. Then S plus, we come now to the older brother, which is correction of the lines around the mouth. It's good for the hands. It's good for the neck wrinkles. And I absolutely love it for the lower lids. So you're gonna see me now injecting S plus where under eye. Always remember S, M, L, XL. S under eye, M cheeks, L chin, XL jawline. This is how I like to teach it. But then once you feel that your hand, took effect while working, then you can teach me later on. By the way, my Instagram is dr.nathalie. I'm gonna put it at the end. Any question you have, any photo you want to share of your work with your name, you send it to me and I will put it everywhere in the world, wherever I go. I've been putting so many doctors' work and presentation before and after. You send me your before and after, and you send me your name and where you are located, and I will say Dr. XYZ from country XYZ did this case, blah, blah, blah. Okay? Any question you have, you send. I have my assistant, his name is Sami. He will convey the message to me. Just tell him, Sami, I'm a colleague of Dr. Nathalie, and I would like to ask her about this. I always answer. Even if it's after 2 weeks, I always answer. So we decided that the soft lips is going to be around the mouth, around the eyes, on the lips, red carpet event, maybe on top of M. S plus is more under eye, more full face rejuvenation, hand rejuvenation, neck rejuvenation. Going to the M is going to be a little bit thicker because the particle size is bigger, so it's more concentrated. So you can do it for the nasolabial folds, for the marionette lines. Consider it as a filler that will open a space. Where would you like to open a space? Where would you like to have this movement? You would like to have this movement in the temples, and the nasolabial folds, and the marionettes, correct? You want to lift. L plus is thicker. I love it on the level of the chin. For now, I don't work on noses, but maybe in the future I will, because a lot of people ask me to do it. Lips, in case you want to give really sexy lips. And XL plus is my personal favorite for the jawline. This is my Instagram. You don't have to follow me, but if you want to ask me any question, it's there. I'm going to keep it there. And I'm going to see your questions now before we start our case. I would like the recording if possible, please. What's the difference between soft lips and S? The difference between soft lips and S is the particle size. The soft lips and S, the soft lips is going to be used for the lips, around the lips for the smoker lines and for the under eye. The S plus is going to be used for the under eye, for the neck, necklines, for the hands, for the rejuvenation. Yes, I did it. Thanks. Dr. Nat, let me ask, what are the advantages of lidocaine and non-lidocaine fillers? I'll tell you something. When you use lidocaine fillers, what does lidocaine do? Think about it. What does lidocaine do? Lidocaine, yes, it takes away the pain, but lidocaine also gives volume. So when you use a product that does not have lidocaine, what you see is what you get, right? So whatever result you see, this is the final result. It will go down, but it will not go down as much as if the patient had, there you go. I think this is Anna who's doing this, right? She's so showing us the concentration. This is the difference between the particle sizes. So, yes, I love to work with fillers that have lidocaine, and I love to work with fillers that don't have lidocaine. I can work with both. But if I have the choice of a patient that needs a tremendous amount of volume for her jawline, let's say, I would go for something without lidocaine because right away I can see the result. Because the lidocaine is going to give me more volume. You got what I mean? And on the other hand, also, for example, working under eye, it's good to work with non-lidocaine. But this comes with practice. With Infini, it's not because I'm the ambassador of Infini, no. It's because I found it to be a soft product, smooth, easy to use. You're going to see for yourself. Even if I have to empty a full syringe in front of you, I will do it. Marwa, hello Marwa, welcome to Egypt. Ahla ahla Masr. Hello. They all have the same concentration of hyaluronic acid of 24, not the same particle size. Particle is different. Dr. Nad, can I ask you, of course, how about combination NHA collagen, whitening max, not using underestimate, they are good or not? Yes, they are good. Today the lecture is about lidocaine fillers. Okay, so we're about to start. Anybody who has questions, ask. Yes, we can do mix between the normal mix between the lidocaine and filler. Yes, we can do mix between both because end of the day it's hyaluronic acid. Yes, you can, but why would you do mix? I mean, you mean you want to mix the products or you want to use in areas without lidocaine and in areas with lidocaine? Yes, you can. All right, guys. Shall we start? I'm gonna go and run. في حالة كان عندنا فيلر بدون اللايدو. Yes, you can. Alrighty. I go there, I stop. Yeah.
5 minutes.
5 minutes, guys. I will go over your questions and I will get back to you for all your questions. I'm not gonna miss a single question, I promise. 5 minutes and we will start with our patient. Keep writing your questions. So we have Yelena here. Yelena has been my patient for quite some time. She has lost tremendous amount of weight. I guess because you moved to Bali.
Yes.
See, I remember. So living in Bali, eating nice food, spiritual country, you feel good, you lose weight, then you come to Dr. Nathalie to fix your face. Lose weight, no problem, and then go to Dr. Nathalie or the colleagues of Dr. Nathalie that will learn how to do the job of Dr. Nathalie, and they will fix your face. So let's start. First, if we take a look, I'm gonna do with you a proper consultation, okay? Can I have a white pen and the mirror, please? White pen. Marker, guys. So let's say for my patient, we are observing, we're doing consultation for her from up to down, okay? So we will start with the upper face. Lift your eyebrows up to the max, frown, smile. So apparently our patient has lost some volume in the upper face and some volume in the lower face. Of course, she does need Botox, but we're gonna do today for her fillers. What kind of fillers are we going to be using? So
Obviously, she has lost volume in the lower lids. She has lost volume in the deep cheeks, fat pads. She has lost volume in the lateral cheek, fat pads. She has lost volume in these, no, don't move. She has lost volume in these areas, and this is why the remaining fat pad is pressing and causing her to have the nasolabial fold and the marionette line. And she also has a nice jawline. She has a nice jawline that is contoured, but it got shortened. Shortened. It was longer. Okay? So, if you look into the mirror, now this is my assessment. If you look into the mirror, what do you feel? What do you want?
I want this to go up.
This is what they say. I want this to go up.
So that this doesn't sag.
Okay, so this doesn't sag. I want this to go up so this doesn't sag, which is correct.
Oh, okay.
So, there's one other thing about Yelena. Other than the fact that we need to replenish the volume at the level of the temples. Why? Why do we want to replenish the volume at the level of the temples for Yelena? I'll tell you why. Because if you take a look at her straight with the camera, when you take photos, you feel like your eyebrow is cut, right? Like part of your eyebrow doesn't show.
Yeah, sorry.
So now we're gonna make it look good in photos.
Okay.
Because when I put the volume here for the temples, she will have an eyebrow that will actually show. Okay? Number 2, we are going to be fixing her lower lids. She has thinning of the skin in her under eye. See, she has plenty of skin over there. Now, this is tricky because if you put too much fillers in there, it's going to get worse. If you put a thick filler in there, it's going to get worse. So you have to be careful to put the right type of fillers there. Then, with regards to the nasolabial folds and the marionette lines, learn something. Let me teach you something, please. This is the part that you deal with last. So after I lift the eyebrows with temples, after I make the eyebrows prominent, after I fix the under eye, I'm correcting the nasolabial folds and the marionette. I correct the cheeks and the jawline, and at the end, I correct this. How do I correct the cheeks and the jawline? How do I correct the cheeks and the jawline? By assessing where I lost the volume. So for Yelena, you see this line here? I call it like the warrior lines. You know, when they go to war and they put like these 2 lines. So this line here is indication that she has lost volume in the deep fat of her face, at the level of the bone. So this is where we are going to be visiting. I have a question for the photographer. Once I'm doing the work, I need you to get close so that they see exactly the level where I'm going. And guys, any questions while I'm working, tell me about it so that I answer. Okay? I will use these markers, please. I have no other choice. Yeah. So, Yelena, you are ready, my love?
Yes, I'm ready.
So,
I can remove the marker after.
Yes, we can. Bone here, and it's a huge bone. It's the temporal bone. It's a big one. But we're not going to go and inject the entire bone, especially that there are so many vessels in there, right? So many arteries in there. So we palpate the corner of the bone and we draw our first line. Then we palpate the zygomaticus bone. And this is where I'm going to be putting my fillers. Now, there are two ways of putting fillers in the temples, either with a cannula or direct injection. How do I decide? We assess the patient. We look at the patient. So in her case, see, I think we did for you temples before, right, Yelena? Yes.
Yeah.
So they were deeper. If they were deeper, I would go for direct injection. Because look at me, remember this. When you do direct injection, you lift, you lift, you lift. So when I go to the bone and I fill up that area, I'm separating the tissue, I'm lifting. This is what we did last time. On this side, she doesn't need much lifting as much as she needs little bit of replenishment of the volume, because once I push my hand like this, see, there is extra skin. So I'm going to use a cannula for her, okay? So here, I'm going to divide the face into two parts. One part is going to be where I write everything, and the other part, I write nothing, okay? So here, we're going to be putting S plus. Now, for the under eye, how do you palpate? There you go. Even if you have your eyes closed, if you put your hand, all of you now, all of you behind the camera, put your hand here and touch your bone. Touch your bone. And I want you to do a drawing at the level of your bone. This is the level that you cannot cross. This is your end point where you can put the fillers. You cannot go above that. So once you do this drawing, you can see that this is where she lost the volume. Under eye, I can use direct injection. I can use cannula. You know, living in Dubai, in this multinational country, women like to be spoiled. They don't like to have a bruise, so they prefer to have a cannula. This is why I'm going to be using cannula, again, S plus. Okay? Then, we get to the cheeks. You remember the warrior line I told you about? This is the warrior line I want to get rid of. This one. Okay? So what I'm going to do is I'm going to inject her with M plus. Lateral cheeks. And in the deep cheeks, I would go for L plus, to be honest. In the chin, relax your chin. Relax. Haha. See here the indentation? She needs Botox on top of fillers there. Right? Because you do like this. Right? When you're sleeping.
Yes. I think so.
Yes. So we're going to do it for her fillers here, but she also needs Botox later. So when you push this area forward, push this area backward, you can correct this part. XL plus is going to be used at the level of the jawline, and L plus slash XL plus at the level of the chin. Now, what do you do about the skin? What do you do about the skin? Yes.
What's going to happen if you cross that line for under eye?
You go straight into the arteries and nerves and veins. So for you to be safe, you go, and the bone is your friend. Everywhere you inject, bone is your friend. There's no arteries there, okay? So this is the problem. The real problem with Yelena is the skin. Why am I telling you this? Because I'm going to do a very nice job for Yelena, but she will still have this. This is because of the loss of collagen and elastin. What should we do about this? Many things.
Okay.
Many things. You can do combination of Infini, Meso. So, after you finish these fillers, you have to come back on a weekly basis at the beginning for at least 4 sessions.
Okay.
Or a bi-weekly basis, I would say, for aqua booster. She has to do a lot of aqua booster so that your skin becomes thicker. Under eye, you can use Amber Plus so that the skin becomes thicker.
Okay.
I always give the example of, you know, when you have a belly and then you sit and you have a double belly. You have one belly here. If I put for you filler, you're going to have a double belly. If I put too much filler for you, you're going to have a double belly. So we would go for Amber there. You have to do treatments like lasers, radiofrequency, chemical peels. You are a lover of the sun. Of course, you adore the sun. Yes, the sun, in your case, is your number one enemy. It's gonna be the thing that's gonna make you look older. So be careful. Okay? So let's get to work. Yalla, 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 yalla. Questions while I'm working? Yeah. So, nurse, head back down a little bit. You mind taking my phone and taking some videos while I'm working? Yeah. So, for this part, like I was explaining, it's not as groovy as that one. This is more groovy. So here, I'm going to go for direct injection, and I will teach you exactly how to find the point for direct injection. Here, I'm going to use a cannula. So we're going to use plus cannula. Oh, one more thing. Guys, we forgot about the lips. After we finish all, let me touch first. We're going to do for you soft lips plus. If you ask me the difference between soft lips plus and S plus, soft lips plus, yes, it is the same size, it is the same particle size, it is the same amount of hyaluronic acid, but it is designed for the lips. So soft lips plus is designed exactly for this type of presentation where the patient has lost tremendous volume, and you can see all these lines showing there, and they are extending into the entire area where she has smoker lines. Are you a smoker?
Not really.
Not really, but
Sometimes.
do you drink from the bottle?
No. But
Okay.
I never did anything with
Okay.
lips.
So once we finish with the cheeks and the jawline, this is going to be fixed. Again and again and again. What does Irina need? She needs fillers. She needs to repeat more fillers. Then she has to go for the boosters of Infini. Eye booster, Amber, Aqua booster, L, collagen, NHA, DNA. All the range is incredible.
Okay.
Then you're going to do some skin treatments after you stop tanning in Bali. After I visit you, you can start taking care of it. Okay.
Definitely.
So let's start with the entry point.
Okay, let's go.
Okay, I'm going to start with the temples. Cannula, S plus, please. 1, 2, 3. Nurse, get closer, please. So this is my cannula. I need the nurse to get closer. Lift this up. Get closer. All righty. Now, this is where my entry point is. So when I do work with cannula for the temples, I have to be really superficial, okay? It's either you go very deep or you go superficial. If you do direct injection, you have to reach the bone. The bone is your friend. The bone is your shield. The bone is where there are no arteries. Then, I'm gonna be very, very slow in teaching you. You press on the skin, see? You create your tunnel. I always tell my students, create a tunnel, then push. 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 See? Create a tunnel and push. See where I am? You can see the cannula. You can see where I am. This is my limit. Okay, do I inject now? No, I go back. I'm dissecting now. I'm separating the tissue. I go inside again. Create a tunnel. Push. Create a tunnel. Push. Create a tunnel. Push. I'm dissecting now. So 1, 2, third part, create a tunnel. Push. Create a tunnel. Push. Create a tunnel. Push. Now I have the space to move. And now I'm going to start injecting. I need Q-tip. 1, 2, and 3. We are using Infini S+. It's written here. All right. There you go. 1. Q-tip. Don't ask me how much I put. It doesn't matter, my loves. And this is the trick with the temples. You just inject and you massage and you're done. And you massage the way you want your lift to be. If you want your lift to be this side, like that, this is how you massage. And I just gave her a very nice lifting effect. Okay? And don't worry, the pen has gone immediately. Okay? So, if you take a look at the patient, you can tell that her eyebrows are already lifted. But, see, there's an advantage of watching my webinars because the only place where I give my tricks is the webinars. So, give me the cannula again. I will give you a trick now. I call it eyeshadow. You know, ladies, you know when you do the eyeshadow? Where do you put the eyeshadow? Where do you put the eyeshadow? I'm going to do for you eyeshadow with fillers.
What?
You're going to have a natural eyeshadow. So the eyeshadow is going to be here, right?
Okay.
So this is where I go with my cannula. I introduce my cannula. Again, the tunnel. The tunnel. The tunnel. I'm in the area of the eyeshadow. And I absolutely love this product for the eyeshadow. After I finish, I'm going to remove the syringe. I'm going to show you how smooth it is. So, this is the eyeshadow. So far, for this area, we only used 0.2. Now I'm going to use like 0.1. That's it. Q-tip. What did the eyeshadow do? It lifted her eyebrow. Okay, mamacita. Show me. Haha. You know, you had one eye that was droopy more than the other one.
Yeah.
Now they are the same.
So don't put this one.
I will not put there. No, seriously, I will not put there. Maybe I will put here just to lift. Just to lift. So it's going to be what? Direct injection, just to separate the tissue. Separate the tissue. Temples, nasolabial folds, marionettes. Separate the tissue. Like this. Like this. Baby shark. If you want to have the baby shark, you do the lift. Okay?
Doctor, we have another question
Yeah.
here. Is it okay to replace your previous brand with Infini if there's still some
Wait.
previous brand?
Okay. Accent. I have to listen to the accent. Speak slowly.
Is it okay to replace your previous brands with Infini if there's still some of the previous brands left in the list?
Of course. Hyaluronic acid is hyaluronic acid. Doesn't matter. But I'll tell you one trick about the lips. If you want your patient to have really nice lips, what I usually do, if there is really old fillers that has been injected in the muscle or in the layer that I don't want it to be, or if there's any filler that has migrated up or down, I melt down everything.
How do you know about?
Just through the injection with hyaluronic acid, hyaluronidase, which is the enzyme that melts down the filler on the spot. Everything goes away. We wait 2 days. You come back, and I do my Mona Lisa drawing all over again. Okay? So this is temples finished. You want to see?
Yes.
Okay. Tell the truth.
Oh, wow.
Yeah?
It's amazing, isn't it?
By the way, Yelena is one of my most difficult patients. That's why I like her. I like difficult patients because they challenge me. And see, when you smile, the wrinkles. Did you notice?
Yeah, immediately.
Smile, the wrinkles has went down. Why?
Because
Why?
it's filled.
Because we put the right product in the right place, in the right quantity, in the right way. Give me the cannula. I want to show them. I want to show you guys the S.
Wow.
See how soft it is. Get closer, please. I'm in love with this ergonomic needle because it's really, guys, when I'm injecting, it's smooth and it pushes softly, and I don't have to push hard. And this is important in the temples because you don't have to put too much force because we are always afraid to break the bone on the temples. So with slight push, this is the S. Beautiful, huh? Beautiful. See? It's a soft product. Love it. I will change my gloves and we're gonna do the under eye.
I love my lip.
We have another question, doctor.
Yeah.
One of our viewers is asking if it's okay to do the filler as soon as 2 days after dissolving, or is it necessary to wait 2 weeks?
I will tell you something. With hyaluronic acid, it keeps on dissolving. So ideally, you should wait for at least 7 days, at least 1 week. But most of the clients, they do not wait. So yes, you can inject after 2 days. It's not a problem. But it's better to dissolve it after 1 week because it keeps on dissolving. Even if it's a very, very, very small piece that they dissolve, they keep on dissolving. Okay? Now, baby shark, do. Alcohol with gauze, entry point. Now, we're gonna go. What is it, guys? All good? Now, we're gonna go and do the under eye. So, you remember the warrior sign?
Wine.
There was
Vikings.
Vikings. I was gonna say that,
Yeah.
like Vikings.
Yeah.
So this Viking sign, it means you have lost volume in the deep fat at the level of the bone. Smile, and when she smiles, she has here indentation. It goes deep inside. What does this mean? In the past, somebody, not me, not Dr. Nat, somebody put for you superficial under eye filler.
I did have a long cut.
Mm-hmm.
10 years ago.
Give me. So we're gonna use the S plus under eye.
So they stay for 15 years?
Yes, it stays because it's. Why does the filler under eye stay this much? Why? Anybody knows? Show me. Anybody is answering my question? Why does the filler under eye stay this much? Answers. Yalla, doctors, give me answers. Distributors. Why?
Bone, close to the bone.
No, not because it's close to the bone. Yalla, give me answer. Okay, I cannot wait. Because this area doesn't move. With your lips, you talk, you kiss, you curse,
Yeah.
Static area.
you smile. That's a static area. It doesn't move. Yes. 1, 2, and 3. So here you go. The Viking sign. I'm going to call it the Viking sign because of you. So we go to the Viking sign. We follow it. And this is where I'm going to enter. Again, my lovely product, the S+. We're going to go with cannula. Tunnel, and we are inside. Now, Yelena is somebody, I bet, when she wakes up with puffy eyes, correct?
Mm-hmm.
Because she has water retention. So don't put too much filler for Yelena under eyes. So if you touch the bone here, you can feel that she has lost volume there. So if you focus on the needle, I'm going to put maybe probably 0.1. That's it. Go back, 0.1. Go back, 0.1. Go back, 0.1. Go back, 0.1. All at the level of the bone. Then she has volume loss here. Go back, 0.1. Ask me any question anytime, Q-tip. How do you massage after the under eye fillers? Outside to inside, okay? Ideally, she needs, other than the S+, she needs eye booster. Wow! Oh my God, you look so good. Damn, woman. Take a look. Eye booster is the only eye booster in the market. It's from Infini. What do you think? Yes. You're standing in the light. You are standing in the light. You have to take a photo from here. Look at the eyes, the difference. Okay? Yeah. Rested, tired, rested, tired, rested, tired, rested, tired. Okay. Let's continue. Now, that's about it. I'm not going to put more under eyes. Maybe later I will check. Now, we're going to go and move to the M+. Can you put numbing cream on the lips? Because my technique is going to cause her some pain. First, give me the M+. Now, remember what I told you? Baby shark, do, 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 right? Baby shark. So baby shark, what does baby shark do? Separate the tissue. Separate the tissue. If you want to separate the tissue, what do? Direct injection. You don't do cannula, right? So this is my direct injection. This is my Viking line. Along the Viking line, I go deep to the level of the bone, and I give 0.1. Second point, deep to the level of the bone, 0.1. Third point, deep to the level of the bone, 0.1. Don't be scared. Hit the bone. Bone is your friend. Do not be scared. Do not be scared. Ha-ha! Now what do you see? MashaAllah. Ha ha ha. It got fixed. Right? Okay? I need more light, guys. Do whatever it takes. Bring me light, 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 light. I want everybody to see the results. Is it enough? No. She still needs volume. Woman, you lost so much weight. Right? You remember what I told you? I told you she will need M+ and L+. So we put M+. Now we're going to use L+. Also, direct injection because it's what? Sing with me.
I cannot.
Baby shark, do, 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 do. Yeah.
So if I gain a weight, what happens? Nothing.
No, Habibti, no, don't gain weight here. Keep losing weight. I fix your face.
Okay, fair enough.
Where am I going to use the L+? The L+, I'm going to use it here. You know, every woman has this part of her face that we call kirs al-khad in Arabic, the chair of the cheek, where you can sit on. No, I'm just joking. This is the point that is mostly prominent. And this is the one. You go to the point that is mostly prominent, you go deep, 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 and you inject. My God, I love this product. You can see how easily it's injecting. Even if it's a thick molecule, it's injecting really fast. I've never seen this with any other product. Again, deep, deep, deep. See. I want them to see how quickly they see the results.
Doctor, we have 2 questions of the same sort from 2 viewers. Is there a need to aspirate?
Always
aspirate. No need to aspirate.
No, I'll tell you something. Always aspirate. Honestly, always aspirate. But because I got used to the anatomy as much as I teach anatomy, I rarely aspirate. But no, you have to always aspirate, especially in the first couple of years of injection. But because I know where I'm going. And if you want, we will ask Anna, because here in the academy, we are going to be giving a lot of courses. So some of the courses are going to be strictly about anatomy, and you need a full day for that one. So if we give you a course about anatomy and I teach you what to expect and where are the arteries, then you don't have to aspirate. And you will, even if you aspirate or you don't aspirate, you will feel safer while working. So this you have to talk to Anna with regards to the courses that we offer in this academy. Again, 1, 2, 3. I'm drawing for her a beautiful cheek. Look. What do you think? What do you think? We fixed this part.
We have got a question from Razan.
Yeah.
How much you put from L+?
All of it. The whole syringe. And if it's up to me, I'll put 2 more. Now, let's go to the jawline. You notice I always start lateral, then I go medial. Jawline, what are we going to be using? XL plus with cannula. Yalla, entry point. XL plus, cannula. You're okay here?
Mm-hmm.
Pain?
Mm-mm.
Okay. So, this is the jawline. It's supposed to be here. It's here. It's supposed to be here. It's here. It's supposed to be here. So, we're going to take it back. We're taking back your jawline.
Thank you.
Yes. Nurse, if there's blood, just remove. Okay. 1, 2. What did I tell you about the cannula? Always create what? Tunnel. Parking. Car goes into parking. Tunnel. Now inside the tunnel. No matter how thick the particle of the filler is, it's so easy to push. Look how it goes smoothly with my finger. Look. Ta 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 ta. So easy to inject. I swear to God, so easy to inject. I'm so happy. My God. Thank you, Infini. That's it. Done. Use another cannula. No, keep this one. So, that's it. We lifted this part. We fixed it. We used the entire thing. I will use another XL. Because I want to work on this area. So with the same point of entry, I'm changing my direction. It's going to be a little bit painful. You know, in this area, if you only dissect, you give the results. If you only do this, you give a patient the result. Yeah. Bear with me. It's okay. It's for your own good. Okay. And we're injecting. My God, so easy to inject. Turn your face to the side. We're going to go up. That's it. Remember what I told you about my patient? That she will eventually need skin boosters because she's a sun lover. So it's much better, but for us to get rid of these parts, you're going to be needing skin boosters. Now, L, please. Actually, I put here XL and L. I will do the L to show you how it works. You're going to have to take a video from this side so that they see right away how the volume goes up. You look good, woman.
Doctor?
Yes.
Our viewer Carolina is asking if you're preferring cannula or needle for jawline.
For jawline, I prefer whatever helps me do the best drawing. In the case of this patient, it's cannula. It's cannula because she has lost tremendous volume and we have to fill up the whole thing. So 1, 2, and 3. La, from here. Exactly from here. Lift your neck up, chin up. And now you're going to see how the chin is filling up. You see? Oh la la, mamacita, you're having a chin now. Wow. You just bought yourself for Christmas a nice chin. Aww. I love it. Relax. 1, 2, 3. Relax. Not bad. Not bad at all. And we are triangular. Hey, no more pyramid. Now, what are we going to finish off with? Treating the nasolabial folds and the marionette. For those, we're going to use the M plus with cannula. And that's the last thing.
And we have a question for you, Doctor.
Yeah.
From Rafi. What about we use XL on chin? Which one is better result, XL or L on chin?
You can both use XL and L. I wanted to show you here. See, I'll tell you something. L is more like baby shark, so to lift the tissue. And then if you want to put more volume, XL is gonna extend more. It's gonna extend more. In her case, no, I wanted to have lifting. So it depends on each patient, but you can use both. Nurse, I need you to clean the face, please, so that they see the results. Now, M plus. Yeah. Turn your face to the side. One, two, three. So here, at the level of the nasolabial folds, guys always aspirate. How long do you wait? 10 seconds. No blood. No woman, no cry. There you go. I went inside and then again, entry point. Nurse, remove the drawings, please. This is where I'm doing my marionette. And she's done. I'll tell you something. Yelena, you need at least, for each side of the jawline, you need at least 3 syringes. For each cheek, you need like 2 or 3 syringes. But this we can do over time. This is what I was telling you. How long does the product last? For example, if you leave now with this quantity, it will last you 3 to 4 months. Any product in the market. But if you put the right quantity, if you come back, let's say next month, and put a similar quantity, it will last you more. Because everything will hold together, okay? Headband up. Okay. So, what do you think? Let's show them the difference between right and left. I can make it even better by putting more fillers on this side, but I was just trying to show you 1 ml of S plus with 1 ml of M plus with 1 ml of L plus with 1 ml of XL plus, what they do. 1 of each. What it did to the patient. You like it? Nice? Okay. Now, I'm going to do the lips. And for that, we're going to do the soft lips plus.
Can you see?
Yes, of course. You like it?
Wow.
Wow, huh? As if you've been to a nice honeymoon with a beautiful gentleman and you were eating healthy food all the time. Yeah? Take a video. Please, show what you were doing. What do you think? When she smiled.
Nice comments here. It says brilliant, nice, looks flawless.
Thank you.
Very nice.
Guys, if you want it to be on point to the perfection, what you would do is more fillers here, because I can really give her this result. I can give her this result with fillers. This.
Without lip going up.
With the lip going up.
Oh.
Like this. Yeah. Now let's do. Now she has a little bit of a sad face. We're going to fix that.
Okay.
Okay? Head back down. We're going to do the lips. This is going to be painful.
Lips very natural.
Of course. What did you say?
Very natural.
Very natural. That's why we are using what? Soft Lips Plus. Otherwise, I would have used for you M or L. So let me have Soft Lips Plus, please. Direct injection. Okay, so first you do open. You're going to palpate. Why do you want to palpate? You want to palpate because you want to see how far can you flip the patient's lips, number one. And you want to palpate so that you can detect any old fillers. She has old fillers here, which is outside of the lip. We're not going to touch those. I need you to focus, when you use the Soft Lip Plus, I need you to focus on the skin of the lips. Does that make sense? So let's say I go inside the skin of the lip. This is how superficial I am. And I inject. And I go back. Retrograde. Look at that. Unbelievable. I need you to take a video straight. This is something very nice. You cannot miss it. Straight. 1, 2, 3. In the skin of the lip. Ay, 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 ay. Look how the product integrates and how it takes its place. Unbelievable. Super nice. Nice. Again, the other side. Now, Yelena, you know what you need also? You need, your lips are very light. You need to have some color, huh?
Mm-hmm.
You need to have some tattoo color.
Actually, yeah.
Because no matter how much I fix them for you, I'm really doing them really nice, but they will not show unless you do something about the color, huh? So now when you're going to put some lipstick on, they're going to show nicely. See how the product integrates? And then you do your lovely massage. I know it's painful, but it's nice. Look, please. Amazing. I want you to get closer. Amazing. Now, what I did for Yelena is I lifted her lips. I did not even put fillers here. These are old fillers, has nothing to do with me. I did not cross this line. Later on, Yelena, you will have to melt down these old fillers, huh? Okay? Me no like. Okay. 1, 2, 3. I'm gonna fix them though to give you the perfect lip shape. Now we're gonna go to the lower lip. Again, Soft Lips Plus is the only product in town that you can use very superficially into the lines of the lips and the skin of the lip. Look how it integrates. Keep injecting. Beautiful. See? With one injection, I filled the entire lip. That's it. Done. Done. Beautiful. You remember the lines you have? My God, I want to put color on your lips so that you can see. Nurse, I think I have color in my bag. Or I will color it with this color. No, I swear to God, because they have to see. They have to see the result. It's insane.
Doctor, we have a question of if this syringe is an S.
This is Soft Lips. This is Soft Lips. This is Soft Lips, guys. This is especially for lips.
And we have another question. question from Zena. How many ml per injection?
How many ml per injection? This is what I'm telling you. I don't look at mLs. I look at the patient itself. Open. I look at the patient herself. It's not about mLs. It's what endpoint you want to reach. So now I did some lifting for her for the corners. Some lifting for her for the corners. And we're done with the S+, with the soft lips. Look, the smiley face. Give me the color, the red color. I'm just going to show you how. We're just coloring a little bit. That's it. Just because you have to see the shape that I just gave you and how incredible it is. Now at home, don't have to do any contouring because I did the contouring for you, my love. Can you believe it? Unbelievable, huh?
I'm scared to talk.
You can talk. You can do whatever you want. Q-tip with alcohol. She has very, 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 very light lips. And she has to... And give me gauze. This is the shape that we gave her. Give me gauze. Gauze, 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 gauze. 1, 2, 3. Just for you to see a little bit the color, the shape. Look at your lips now. What do you think?
They're big for me.
They will go down. No, this will go down. These lips,
But they're beautiful.
they are beautiful. The shape is
I'm
insane.
I'm not used to that.
This is a very, 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 very natural result where we used a full ml on the entire lip. Now, let's dig the headband up.
Nice.
Nice, huh?
Okay, this is nice.
This is nice, of course. Yeah, when you're sleeping, the lips they look bigger.
It looks bigger, yeah.
Please remove all the colors. Relax your head. Nurse, all the colors remove. So what do they think of the lips? This is soft lips. This is not even S+. This is soft lips. And the reason I did the coloring just for you to see the shape we did for the lips with the soft lips. So half of the face is done. Half of the face is undone. And this is the wow, the final result for the lips.
You said very nice, great.
Yes. Thank you. Now, if you want to do more, you still feel like it's too much?
I'm not used to it.
Okay.
But I like
This
it.
is natural.
Yeah,
this is
I like
natural.
it.
And did you notice the smoker lines?
Yeah,
They're gone.
It's gone.
The smoker
And it's
lines.
really lift even
The corner.
the corner.
No
yeah.
more sad face. Only happy for New Year.
Doctor,
Wow.
we have a question from Walid.
Yeah.
Can we use XL for lips?
No, of course not. It's too thick. It's too thick. And if you use it first, if you want to use the XL for the lips, you're going to be using a thick needle, which is painful for the patient. Then the minute you inject it, it's a thick product, so it will accumulate. So why would you use it? If you have options of doing something soft, and then something stronger, which is S, something stronger, which is M, something stronger, which is L, why would you go for XL? Don't risk.
I need this sometimes.
Okay, so we're done. Smile. And let me see. You are a beautiful woman.
Thank you.
So we're going to continue the half face after the session. Now we're going to move to the next patient, and I will continue with you after we're done.
Okay.
Guys, any questions? Now is your chance.
So for Russian lips, soft MOS.
M. M and S and soft also. So you can do M, 1 ml of M. On top of it, you do this, the soft L plus. Probably I will do it for you because we have a candidate. What's your name? Lena. Lena has very thin lips. Probably we'll do it for the next candidate.
And Rafi is asking if soft lips is a superficial injection.
It is superficial. That's what I said. It's the only product in the market that you can inject superficially. Next question. Stop. Okay, guys. 2 minutes break. I'll bring the next candidate.
See you.
See you. couldn't help but show you after 5 minutes of waiting how the product has integrated already. No swelling, no bruising, no nothing. And we did half the face, we did the lips, and I leave the talk to Yelena. What do you feel?
I love it. I feel that this part is completely lifted, and my eyebrow as well is lifted. This part.
Smile.
I love my lips.
All righty.
Yeah,
They will
very
go
nice,
down.
Beautiful. No, really, and here as well. It's like really young skin, feeling plump.
By the way, this was the most
Yeah,
challenging part.
yeah,
This is the most
yeah.
difficult part for you to treat,
Yes,
by the
because
way.
I had a little hole inside here, which is
The
amazing,
Viking.
Yeah,
No more
amazing.
Viking. Okay.
And I have this triangle.
Triangle.
Yeah,
Thank you.
beautiful.
Thank you.
Thank you.
Thank you.
Thank you.
All right. Now, Lena, Yelena, wait for me so that I can do the rest of your face. Yalla. Lena, give me mirror and pen. And Yelena was red. Would you like to be blue? Blue is good? Yeah. So tell me what you want.
My main concern is the eyes.
Aha.
And thin lips.
Wait, but in the under eye, you have fat here, right?
No, it's old filler, I think.
Old fillers and fat, both. See, when I tell you that old fillers, what, 10, 15 years?
No, this is only like a year old.
A year ago? Okay. So it's been a while because it's a static area that doesn't move. And did you feel that when they did for you fillers, your eyes became better or worse?
Better.
Better. Okay. So for Lena, also, she has a case of loss of skin elasticity under eyes, groovy lower lids, old fillers that we're going to have to be working around, and loss of volume in the lateral cheeks. Nurse, I need the pen, please. So again, we will start our assessment from up to down. So in the area of the temples, we can put fillers. It will not do much. And I'd rather not put it because already Lena has a nice cheekbone. If she has a nice cheekbone and I put for her filler here, she's going to look round. We don't want this to happen, right? Okay, so we're going to leave your character, Lena. So what I'm going to do is I'm going to be injecting definitely the under eyes. We palpate again. All of you put your hand under eyes and do the drawing for the under eyes. Here she has old filler. We're not going to touch that. We're just going to put fillers where my dots are. That's it. My filler stops here. It doesn't go any further because here she has old fillers, my friends. Now, for us to give her a nice lift, let's stretch the skin. Once you stretch the skin, see how much skin you have here? This tells me that something was holding the skin before, which was fat. It was gone. So we're going to replenish this fat. We are going to be putting fillers where she lost the volume, which is in the super lateral cheeks. Here. All this area has to be filled up, even at the hairline. Even you can go deep to the inside with a cannula and fill up the hair from inside. Now, for the jawline, we're going to do the same as well. She's going to have some filling here to lift this part. Chin is retracted. She really needs the chin. Rafi, this is where you can use the XL. You got what I mean? Because she needs extra volume. And we finish off with the marionette and nasolabial folds. And definitely the lips. Now, the lips are going to be challenging. She needs time for the lips, not from the first session. Today, I'm going to do for her probably the M for the lips because we need more volume. So what's the difference between her and Yelena? Both, we use S plus under eye. Both, we use L plus and M plus for the cheeks. especially for the Viking line. Both we use XL plus for the jawline. But for Lena, we're going to use XL plus for the chin. And we are going to be using M plus for the lips. And both of them, we used M plus for the nasolabial folds and marionette. So S, M, M, XL, XL, and M. If you want to take a screenshot of this, take your time. I'm going to give you some minutes.
We have got questions, doctor. Is it advisable to inject into nasolabials? Because in many cases, a swollen face remains when smiling.
Yes, it's a very good question. This is why I always tell you, do not inject the nasolabial folds unless it is necessary. You noticed I filled the temples, the under eye, the lateral cheeks, the mid cheeks, the lateral jawline, the chin, the lateral chin. At the end, after I fill all of these, if there is a line that is still like groovy, then I go with my cannula, I dissect, and I put a tiny bit, just like I did with Elena, okay? Because you are right. You will become like some people, they become like a ball when you put for them fillers and the nasolabial folds. Now, in the case of Lena, if we put a bolus only here, she will look good, by the way. And it will make the nose look smaller even. Now we will assess while working. Ready, Lena?
Mm-hmm.
Go back.
And I have one more question, doctor. Yeah. What size needle do you use on soft lip?
32 gauge. All righty. Sleep, sleep, sleep. It's anyway, it's the needle that comes with the package of the Infini, so they don't have to worry about anything. Let's start. What are we going to use under eye? S plus, cannula. So we're going to do first our cleaning. One, two, and three. Again, what did I tell you? Parking, car, tunnel, car. Create your tunnel and push. Oh, you have oat fillers, young lady? Mm-hmm. That's why I have resistance. Okay. 1, 2, and push. Boom. Now, see the head of my cannula? See the tip of my cannula? Are you okay, Lena?
Mm-hmm.
Okay. So I'm moving on the bone. So this is where I am. And I'm going to put a tiny drop. And the nice thing about the S plus is even if you have oat fillers, even if the patient has swelling, even if the patient has water retention, even if the patient wakes up in the morning with puffy eyes, it's a good product to use. Do not be scared of using it because it's very hard to find a product that you can use in these cases that I just mentioned. Water retention, puffiness, oat filler. It's very difficult to find something that's going to give you a nice result without making the patient look awkward. Done. Look at that. Please. What do you think? Mamma mia. Amazing. Give me the Q-tip, nurse, please. Q-tip with alcohol. We cleaned the area. We cleaned around it. So if you want to have it, the trick that I did is that I assessed where the oat filler was. This is the oat filler here, and she does have fat. See the fat? It's so obvious, the yellow thing. So she has fillers here. I didn't touch this one. I injected S plus around it, in front of it, behind it, behind it, behind it, behind it, behind it. I'm going to re-enter, and I'm going to put some even S plus here to give you a nicer lift. Give me cannula. What do they think? 1, 2, 3. There you go. There you go.
Our viewers think it looks great.
Thank you. So there you go. Guys, she's a difficult case, huh? I like in the, no, opposite to other doctors, I don't like to bring to trainings easy models. I like to bring difficult models because this is what we see in our work, right? Easy models, they don't need training. Difficult models need training. Now, let's do the cheek. I'm gonna go in the highest point, the one that I like, and I'm gonna go upwards, and I'm gonna go downward using my cannula. I will use L+. See also the nasolabial fold, it has lifted. If you want to show, look, here she has prominent nasolabial fold, here it's gone. Bye-bye. Hasta la vista, baby. You want to see yourself?
Yeah, beautiful.
You're welcome.
Thank you.
Welcome. Happy?
Right.
You know when they say happy wife, happy life?
Mm-hmm.
Make wife happy. So this is my highest point of projection for the cheek. I'm gonna go with my port of entry, right and left dissection to make my life easier when I use my cannula. And there we go. So this ergonomic needle is insane. I absolutely love it. See where I am? So we're gonna go a little bit. This is a trick. We're gonna go a little bit under the hairline. Boom. And we're gonna start injecting. Wee. Half a syringe already injected. Go back. Put more. Go back. Inject. Medially, this is when I'm drawing the cheek and lifting it. There you go. And you see the immediate result, how beautiful it is. All you have to do is tap your finger a little bit and she's done. That's it. That's it. Nurse. Let's clean here, the upper part, so that they can see the results. Gauze with alcohol, please. Lena, take a look at yourself in the mirror. Cameraman, show Lena's cheeks, please. In front of her. In front of her. Go in front of her. Not from the side, ya habibi. From there. Ya ibni. In front of her. You want to show the cheek of a woman, you see it straight in the face. Look. What is this? Magic. Shoo. Beautiful. Yeah. Love it. See, anyone who was asking me about the nasolabial folds for Lena, in her case, I don't need to go anymore with cannula because I lifted the whole thing. She doesn't have a line that is prominent, so now I can do just one injection here and it will lift this part. Okay? So we used one S plus and one L plus. That's it. Now I will use here XL plus with cannula. Yeah. XL plus with cannula. XL plus with cannula. Again, my entry point. Whenever you want to show the result, you stand in front of my patient, not behind them, not to their side. Okay, Mr. Photographer? Okay. We have students to teach here. So, see? This is my cannula. This is the bone. You palpate the bone. This is the cannula. You want to give her a cheek. Why? Because you want to give her, a jawline. Why? Because her cheek is prominent and her jawline is too much to the inside. You want to pull it up. So I'm injecting retrograde. She needs a whole tremendous amount of fillers there. But see how the XL did the drawing? Did you see how instantly she has a jawline now? Again, I go inside again. The woman has a jawline now. That's it. We're done. And this is 1 ml. Stay here. Stay here.
Doctor, one of our viewers would like to be your model.
حبيبتي. It's a he or a she.
Jason.
Okay? You're welcome. Goes with alcohol, please. It will be my honor. Anytime. Where do you live, Jason? There you go. You have now a jawline.
I love it.
Love it, huh?
So nice.
Jason lives in London.
Come, Jason.
Come to
Invite me to London. Unbelievable. I'm so happy. What do you think, guys?
I love
Oh
it.
my God, I'm so happy.
So nice.
So happy. Yes.
Mhm.
Yes. Now, go back. Now, let's create for you a nice chin. You know what? After I did the jawline, what I'm gonna do actually is just to put a drop of M+ direct injection to the nasolabial folds and also to the marionette. I told you why I'm not using a cannula, because see, this line is gone. So why would I go with a cannula and fill it up? It's not there anymore. What am I gonna go and fill? It's not there, right? So no line, why would I go with a cannula? So she has here some volume loss. What I would do is what? Remember, bone is your friend. You go to the level of the bone. It's safe. You ask the patient to take a deep breath, and you take yourself a deep breath so that you don't go into an artery. 1, 2, 3, deep breath. Go inside. Boop. I'm at the level of the bone. Aspirate. 10 seconds. 1, 2, 3, 4. Okay, 5, 7, 9, 10. Da, da, da. And now inject. That's it. Done. Finished. How was it? She doesn't look swollen. Her face has not become puffier. Nurse, I need you to remove the blue color. And I want to show you just by the drop, one drop of filler to the nasolabial folds, what happened. I need the Q-tip with alcohol. What do you think? Nice, huh? Now, okay. Go back. For the marionette, after what I've been teaching you now for the past hour, would you inject the marionette with a cannula or direct injection? Can you tell me if they understood? Would you inject the marionette with a cannula or a direct injection?
direct injection, says Jason.
Mm-hmm.
Jason, I love you. I'm going to do your face, but you use the cannula here. Why?
Just cannula.
Yes.
Mm.
Yes. Why? Because, see, she has a skin that has gone down and a sad face has gone down up till here. So I have a pathway. The needle is this long. I need something this long. I need the cannula. So I will go from here and play around. Fill up here, the chin, fill up here, fill up there, fill up there. And since she has good volume loss, I don't mind using XL plus and continue with the chin. Cannula XL plus. Go back to sleep. Blue suits you.
Good.
Yeah. 1, 2, and 3. Yeah. Cannula. Remember, it's a thick product. I know. Pretend that you're happy. No, guys, seriously, for the patient, this is the area that hurts the most. But make sure you dissect always, because it will help with the result. I dissect. 1, 2, 3. Dissect. Go back. Dissect. Go back. Dissect. Go back. She already has the result without me injecting even. Dissect. Yes. What do you want here? What do you want to achieve? You want to lift this part. So you want to give a base for this part. So this is where you want to really inject. So 1, 2, 3. I'm injecting. I am injecting. Relax. Try to relax. No sounds, please. Then, like this. Yes. Then, she's a brave lady. Still has a sad face that I will correct with the lip fillers. That's it. Done. Much better, mamacita. Now your chin is more elevated. Can we wipe the XL from the chin, please? Nurse? No, if you want to take the chin, you take it from this side, because this is the side I worked on, not from that side. Over there, nobody worked. Very, very, very nice. So, done. Now, what we are about to do. So, we lifted the entire face. Know your anatomy, the skin, the fat, the muscles, the bone. If you know all of this, the ligaments. In another chapter, we will talk about ligaments. Also, you have to check with Anna for that, for the courses, because we have different ligaments in the face, and accordingly, we can do the lifting of the face naturally. Thank you for bearing with me with the pain. Okay? So, take a look at the patient. Done, undone. What do you think? Nice, huh? This is still droopy. This is still down. This is all down. This is smooth and lovely. And this is 1 S plus, 1 L plus, 1 XL plus. Did we use M plus? Not yet. Now we're going to use the M plus for the lips. Go back. This is going to be painful.
Jason says the result is brilliant.
Thank you.
Great balance.
Thank you. Yeah. Okay. So take the headband down, please. And the last patient, we use the soft plus. No. Go down. Down, 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 down. Come to me, my love. Come to me. Listen, this technique is painful. Okay? Try not to scream. We only scream when we are at the dentist, right? I'm not a dentist. More alcohol, please, on the gauze. It's dry. And M plus direct injection. Yeah, let's do this. Let's do this. Yeah. So, again, we assess, we palpate, open your lips. Have you done fillers before? You've done. So, she's done fillers before. Luckily, they are not so bad. By flipping the lip, I can see how much volume she can give me. So, she has this space that I can fill. If you take a look here, she has old fillers underneath the mucosa that were injected. So we don't touch those. They were not supposed to be injected there. We're going to start by flipping the lip. 1, 2, 3. I'm so sorry. Try not to scream, please. 1, 2, and 3. Retrograde. See? See how instantly I got a lift? This is lifted. This is not. I want you to focus on that point. Can you see it? This is lifted. This is lifted. This is not. And this is with 0.1 ml of filler. Again, you also need color. Maybe more color or more kissing. Huh? Kissing gives color, no? So, there you go. Relax. Don't smile. Don't smile. So, lifted, not lifted. Again, on the other side. Yep. You are doing great, Lena. We love you. Thank you for sacrificing yourself for the sake of the coming generation. Change the needle head, please. Huh? There you go. Now, Lena is a challenging case. You understand that because she has very, 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 very thin lips. But despite that, I'm giving her a very nice shape. Nurse, M+. Wipe the blood with the Q-tip. We're gonna do now the lower lip. I'm in love with this ergonomic needle. My God, this is so comfortable. Oof. Because I'm very fast. I see like 20 to 30 patients a day. I can finish a full face in 6 minutes. So I need something that is quick, quick, quick. So this really goes fast. I love it. And it doesn't hurt my hand. Open, It's fine. Tolerate, tolerate, tolerate. One entry point. I filled the whole thing. Done. Close. Then, see? Sad face is almost gone. Nurse, please, blood. Open, We're gonna get rid of the sad face now. We're gonna get rid of the sad face now by injecting the corner. Close it. I will continue. Open, little bit of massage. I'm not done yet. Don't change the needle head. Not yet. Close. Let me see the lips. All right. What do you think?
Amazing.
Amazing, huh? Lena, you have lips now. Give her the mirror, please. Now, the audience is going to decide.
Wow.
Wow, huh? Nice.
And you were so quick. I didn't know-
This is me being slow, by the way, because I'm teaching.
I haven't noticed anything. It's like beep, 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 beep,
Beep, beep,
beep,
beep, beep, beep, beep.
Yeah.
Okay.
Comments.
Yes.
Stunning, marvelous, amazing.
Amazing.
Now, audience, do you want me to continue with M+ for the lips, or do you want me to show you if I put soft lips on top of M+? What do you want?
Zena says yes, please.
Soft lips on M+?
Jason, soft lips.
Soft lips, yeah, soft lips. Soft lips. Now you're gonna see.
Maria says yes.
Yes, so because this patient, so we did for her the shape. Now she has the shape. She used to have 2 lines. Now you have lips. My lips like sugar. Yeah. No kissing, my love, huh? Usually when they do fillers, whether the patients come to me for lip fillers or for butt fillers, first thing they do is kiss the boyfriend, or the boyfriend will spank them because the ass looks good and the lips look good. So no kissing for tonight. No kissing. Yeah. Again, the soft lips is superficial. Relax so that I can give you extra glow, extra volume. There you go. Open, All righty. This is what we were looking for. This is what we were looking for. Rejuvenation without over volume. Simply rejuvenation. Close. Same thing for the lower lip. This one's gonna look good. Again, I need the red color because if you do coloring for your lips, they will look marvelous. My work will show better, huh? Because they're very light. Red. Tiny bit of red. Just a tiny bit. Tuck, 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 tuck. Gauze. Guys, you are in my light. So call me your sugar. Nice. شوفي عم بتصوروا ولا بعدكم ولا لا؟ Okay, guys, the battery is gone from the camera. Don't think there's anything. Okay, so we're just changing the battery. Give me. Oh, woman. I love it. Sit up, sit up, sit up, sit up, sit up, sit up. Nurse, headbed up. What do you think? No, give her the mirror. Check yourself. What do you think?
Wow, I love it.
Yeehaw! Woo!
Very nice.
Nice? And we're done. You happy?
Very happy.
Everyone is happy? Happy patient, happy doctor, Happy Infini, happy photographer, happy nurse, happy everything. Everyone is happy. Happy New Year! I love you guys. I wish you a very Merry Christmas and a Happy New Year. I'm always available for you 24/7. My Instagram is dr.nathalie, and you can send me anytime. My assistant Sammy will respond to you. Sometimes it takes me a week to respond, but I always respond. And if I don't respond, just tell Anna.
Everybody's saying thank you.
Thank you, guys.
Amazing.
Hugs and kisses. I love you. Happy New Year. Bye.